last but not the least, the most useful practical topic in our discussion is my new teeth for grandma and grandpa, which is basically for senior citizens, for our grandma and grandpa who has lost their teeth and they want their smile back. So teeth are lost during age. In India, basically, it has become one thought in people's mind that daant hai, and after some age that the teeth has to be gone. It's a natural process. But we have discussed earlier in our lectures that it's not a natural process. That our teeth are lost just because some problem. There must be some cause for their loss. Otherwise, teeth cannot be lost till our death. The loss of teeth may be because of its decay. Then completely loss. We first lost our crown structure, and some part of the tooth which remains inside the bone need to be removed because we may have pain because of that. Teeth may be lost because of problem into the gums. That because of that we lost our bone that supports our teeth. That may be a reason, and actually this is the most common reason in losing our teeth. And finally, by anyhow, if we are going for removal of our teeth, we are going to miss our teeth. Finally, loss of complete teeth in our results in this kind of situation. And edentulous situation means a situation in which patient does not have any teeth remaining in the mouth. So only the bone is present into both the jaws, and which is completely covered with normal gums. Or now this gums is actually a simple skin. It's basically does not remain as a gum. It remains as a normal oral skin, which same as of cheek skin from inside. While losing our teeth, what we are losing along with these teeth? First of all, the facial feature of patient changes after losing, especially after losing his or her front teeth. The facial feature, our teeth supports our lips. Our lips curvature is supported by our teeth. So after losing teeth, the lips starts becoming inwards. Then the facial feature changes from a smile to this condition. Next, as we have discussed in our first lecture, along with losing our teeth, we lose the ability to chew any food. We could not speak properly because some alphabets are pronounced properly only with the help of teeth. And moreover, we lose our smile. And because of these all things, we lose our presentation skill in our society. These all are basic needs that we require to be alive in our society, to have some alive personality in our society. So teeth are at most important important thing for this. Moreover, and in what we are losing in our mouth along with teeth, we are losing bone, and that's how I let you know regarding about this. Just see, this is diagram. It's moreover a scientific diagram, but just try to understand this, please. This is the diagram is showing our lower jaw. In this lower jaw, we have a part of there which is seeing is a main part. It is a bone, and you can see the teeth. Anyone can appreciate this, right? Now, in teeth, can you see some part of bone is present into the teeth, and we can imagine that some part of the root is present in some part of bone which is covering in the root of the teeth actually. Now, when we lost our teeth, after losing our teeth, the part of bone which is covering any part of root or tooth around the teeth start losing, and the condition becomes the same edentulous condition. So along with that, we also losing some part of bone along with that teeth. So this is a more silent something we are missing silently in our mouth. Now, in dentistry, there are different treatment modalities to get back these all missing teeth and a smile. Now, there are different treatment modalities to get back your complete teeth. The first and the most common treatment modality in dentistry is giving a complete denture. See, when we are losing a teeth, the first in previous eras, before 20 years back, there was no any thing because that time when any fixed processes was thought. So that was the thinking that for a fixed processes, something should be there other than bone to which we can take support to give that fix. So we have discussed with Dr. Vaibhav Agarkar that for giving a fixed processes, we need teeth around that for giving fixed processes. But in when we have lost our complete teeth in our mouth, then we only have to take support of our bone. For taking support of that bone, we attach our artificial teeth with this colored pink color plate. Pink is just because it should be look natural like our gums. So we attach, and this plate, it extends over the bone, over a particular area over the bone, and that it takes supports from the bone. This is most conventional treatment modality, is called complete denture. Nowadays, the main problem with these, we will discuss later on also, that it starts getting loose, and sometimes the bone is not, the amount of bone is not so much that it gives proper support to this denture. So the new treatment modalities in dentistry is implant. So with the help of those implant, we can take support of we can give support to this denture, and these implant are placed into this into our bone, into our jaw, and the denture are placed over that. So the denture, it does not become loose. It takes an extra support of this denture. The denture takes extra support of this implant other than bone. So actually, this is just a diagram. Number of screw we require depends actually individual to individual. Minimum 3 to maximum 5 screw are required in a jaw. There are 4 screws, and it's the most latest and treatment modalities in implant also, in which we are able to give a fixed prosthesis into the mouth only with the help of implant, without taking direct support of the bone. Direct, I am saying, because implant itself is getting support from the bone. Now first we discuss about this conventional complete denture prosthesis. It's very common, we all have heard about this and have learned about this. It's fabricated when we when doctors start taking start doing treatment for complete denture. First take impression. It first take a complete impression of our jaws, upper and lower jaws in it, and it converts your pour this with some particular stone that make a same model as is in your mouth, the shape of your jaws, and over that this denture is fabricated. After some procedures, like after taking impression, it takes some bite, then this all things are transferred to a particular dental tools called articulator, in this that exhibits or bite movements, everything. And over these teeth are placed, they are fabricated using special plastic kind of material which is called acrylic, and this denture is formed. But the problem with this complete denture, as we had discussed, first of all, it may become loose with time. It may become loose with time because it's a plastic. It has tendency, this chemical which to which this denture is made, it has tendency to shrink after time. So it starts getting distorted after a period of time. So we need to change this denture after a particular period of time, because it may start getting loose. Second problem that we had discussed, after losing teeth we start losing our bone. That prevention of bone losing cannot be prevented by using complete denture. only after using even this conventional complete denture, we have bone loss problem. The two more important things. First, it has plates. It has some plates, some area that we had discussed, which covers some part of bone, and some area of our mouth, like upper denture, covers some part of our palate. That palate area exhibits some perception ability for some cold and hot food stuff. So if we are taking some hot stuff, that perception, that hard palate area tells us that this thing is cold, this thing is hot. So some kind of taste perception is also lost with this complete denture. And the most important, that areas also exhibits ability to speak some alphabets properly. So they may have patient suffers some kind of speech problem after using this conventional complete denture. Now the second option comes for implant supported over denture. In implant supported over denture, some implants are placed into the jaws, upper and lower jaw. We had discussed how the implants are placed into the jaw. I would like to discuss because there are 4 new member in our lecture now. Implant is just a simple device which exhibits our roots of our teeth. We place this implant into a bone after a minor surgical procedure, which is completely painless. This implant is made up of complete titanium material, which is a screw-like device. Why screw? Because it's a threaded-like device which is placed into a bone, and bone get anchored with this, attached with this properly after a particular healing period of 2 or 3 months. When in a surgical procedure, a simple cut is made into the gums and the bones are gums are reflected, bone is exposed. Then with the help of simple armamentarium, the space is made for placement of implant. When the implant is placed, everything is kept properly and the suture is made. After giving everything, the time is given to the patient for a primary healing, which is of 2 or 3 months of duration, maybe of 6 months. Depends on physical and medical health of the patient, especially in diabetes patient, especially in uncontrolled diabetes patient, because uncontrolled diabetes is contraindicated implant, because there is no healing procedure in uncontrolled diabetes. But in controlled diabetes patient, the times is actually long. But in normal patients having normal medical and physical condition, the normal time to taken for healing is basically just of 1 to 2 months.
How it doesn't pain?
Ma'am?
How it doesn't pain? It should pain, no?
No, ma'am, everything is given under anesthesia.
No, for healing, during healing.
Healing, yeah, actually for 2 or 3 days, a patient may feel some kind of as normal pain as it gets after some normal surgical procedure.
But no pain.
No, after that's no pain, because it's a titanium, and that's why the metal is of titanium. It's a noble metal as of gold. It's a more noble metal than gold, I should say, because it contains the titanium has such quality which is completely biocompatible. Means I can place a pure titanium like device inside our body, and body will not react anymore with that thing. It's not a steel or something aluminum kind of, it's a titanium one. That's why healing is as normal as on other parts of body. So after healing everything, when the implants are placed into it's a successful implant are placed into a jaws, then these dentures are fabricated over that. The only advantage we get from this implant supported over denture, that the denture we are getting after this implant supported is more has better retention. It does not get loose easily, and second is a bone remains preserved. Bone loss does not occur because there is no direct load over the bone as was with the conventional therapy. In conventional complete denture, the direct supports are taken from the bone, in this we are taking support via implant over the bone. So these two, but the next two things, which one is some perception over the heart palate and speech problem still exist into the picture. So that this is the procedure. If a patient is having completely edentulous area, we place implant, and after placing implant, we fabricate a denture over that, and the denture is placed over that. We have some particular connection between that, so that the implant can be removed or the denture can be removed and can be placed regularly. And one more option, sometimes patients demands for, I want this denture completely placed and I want to remove it after 2 weeks. So it's actually very rare, but it's also in field that these dentures can be screwed into the implant. And after 1 or 2 weeks visits to dentist, the dentist remove the screw, remove the implant, clean the area, further place the implant. But that's actually not properly indicated, because that results in more unhygienic condition underlying the dentures, which finally harm your bone.
This implant is possible when all the teeth are lost.
Yes, sir. That's what I'm saying. That's what I'm saying. No, otherwise, means I couldn't get it.
Few teeth are lost.
Of course, implants are also possible in that time. So in yesterday's lecture, we had discussed about that only. Implant is the final, is the ideal treatment modality in those cases when we have lost the teeth and we want to get our teeth back as natural as it is, as it was. It can be 1 also, it can be 2 also, 3 also. 1, 3, multiple or complete.
Very expensive.
Ma'am. Yeah, so it costs, because as I told you, it's a pure titanium or titanium alloy. Means of more than 70% of implant is made up of titanium. More than 70% part of implant is made up as pure, exactly pure titanium is exactly like pure gold. Now pure gold is completely malleable. You can stretch it, you can do it. But we make the gold sometimes somewhat impure. So it has its own strength. So when as same is titanium, we make a titanium coated, we have a implant which is titanium coated and some impurities there which make this metal give the metal good strength. But the main part of implant is titanium, which is completely biocompatible. And actually titanium is more costlier than gold. So you can understand its cost is not cost effective.
Cost per tooth.
In implants, basically it depends on to which company implant you're actually getting. In market there are different kind of implant. That's a final cost of for a single implant goes from 25,000 till 45,000. Depends on to which company. There are many companies are making it.
Single implant is
So single implant.
That's one.
one teeth.
Yeah, very expensive.
It's very expensive, sir, but it's actually an ideal treatment.
Then teeth are for
No, but what happens? Supposing 2 or 3 teeth are lost. You make implant.
So I will give you, yeah, regarding implant everything, I will give a proper answer. I will show my previous presentation, my yesterday's presentation to all of you. Sure. Just for this, still we are having some problem with implant supported denture because we are not having, we still not have ability to perceive hot and cold and speech properly, because or some area of our mouth like hard palate, they are still covering some part of our gums is still covered by this acrylic plate. So the final treatment, which is the most latest in implant also, is the implant supported full mouth fixed prosthesis. In this, the implants are, when the implants are placed, the full only teeth are placed with the help of implant. But the only indication, only contraindication in this thing is the bone level, particular bone level is demanding in this case. A particular amount of bone should be there in mouth. Then only patient can go for this kind of processes. After this kind of implant supported fixed process, we can smile as natural, we can eat as we were doing. So thank you for this lecture. This all about complete teeth replacement in our mouth. I just come to my previous lectures.